neck. طلاب المرحلة الثانية anatomy and قسم التشريح anatomy and cell biology. second course head and neck course. Okay. Our objective on this lecture is to describe the facial layers of the neck, function and contents compartment of the facial layers. Also, we will describe the anterior triangle, posterior triangles, boundaries and contents of these triangles. Facial layers of the neck. Briefly, two main types, superficial fascia and deep fascia. Superficial fascia usually between derms and deep fascia, which contain cutaneous, nerve and vessels, lymphatic, fat, and platysma muscle, and contain also platysma muscle. The platysma muscle action of the action of this muscle is the tense of the skin of the neck. When you tense the skin of the neck, okay, so this make the skin on the neck, especially below the mandible, tense. These muscles considered as a remain of the cutaneous trianges muscles, like in the horses or in the we saw that when any stink or any attached to the skin and this move, the muscles of the animal will move to against this insect. يعني نشوفها مرات بالحيوانات عندما حشرة توقف على الحيوان فهاي الجلد يتحرك، فهاي هي احنا بالhuman just below the skin of the just in the neck, while in the animals usually spread through the whole of the body. Okay, it's supplied by cervical branch of the facial nerve. Well, the deep fascia of the neck consists of three layers. Investing fascia, pretracheal fascia, and prevertebral fascia. Investing fascia surround the entire neck beneath the superficial fascia and sits enclosed trapezius muscle. This is sinochleidomastoid muscle, and these are trapezius muscle, and this will enclose them. Okay. So it consists of three layers: investing, pretracheal, and prevertebral fascia. Investing fascia enclosed, also enclosed parotid and submandibular gland. These are investing fascia. Enclosed the parotid and submandibular glands and form the roof of the anterior and posterior triangle. Pretracheal fascia formed in the anterior part of the neck from the hyoid bone superiorly to the fibrous pericardium. Okay, which has two portions, muscular layer and visceral layer. Muscular layer covered infrahyoid muscles, and visceral layer invest trachea. Okay, invest trachea, thyroid and parathyroid gland, and also esophagus. So these are pretracheal fascia. The prevertebral fascia surround the vertebral columns and associated muscles. With these muscles, scalenus muscles, longus colli and capitis muscles, and also posterior cervical muscles, which fuse laterally with the axillary sheath. We have important fascia, which is called carotid sheath, which is a condensation of the fascia around the greater vessels which extend from the base of the skull to the root of the neck. Okay, blends medially with the prevertebral fascia and laterally with the pretracheal layer of the fascia, which communicate with the mediastinum inferiorly. This is the carotid sheath. Also, the contents of the carotid sheath contents of the carotid sheath, which are common carotid artery, internal carotid artery, internal jugular vein, vagus nerve, deep cervical lymph nodes, sympathetic fibers, and carotid body. Retropharyngeal space. Retropharyngeal space between the prevertebral layer, buccopharyngeal fascia, which extend from the skull base to the posterior mediastinum. The function of this is allow movement here, the prevertebral fascia, retropharyngeal space. As retropharyngeal space allow movement of the viscera of the neck during swallowing, and also it's a potent space to spread of infection from the esophagus to the superior mediastinum. Sometimes infection of the lymph nodes here, infection of the lymph nodes in the retropharyngeal space, especially in case of tuberculosis or TB. This will lead to formation of the retropharyngeal abscess here in the retropharyngeal space. So, and this will lead to formation of the abscess in this space and may extend into the superior mediastinum. The other space that form is the pretracheal space. Pretracheal space between the pretracheal space between investic fascia and the pretracheal fascia, which limits attachment superiorly by the thyroid cartilage and can spread into the anterior mediastinum, anterior pericardium. Okay, to the anterior pericardium, not just anterior pericardium or anterior mediastinum. Space between two lamina of the vertebral fascia, just the space between the two lamina of the other space between the two lamina of the prevertebral fascia, which is a critical space, extend from the base of the skull and through the thorax. This is not important in our lecture, but the pretracheal space, retropharyngeal space, and also these are very important and potential spaces. Now, we will move to the triangles of the neck. The muscles that play in joining the two sternocleidomastoid muscles that divided the neck into anterior triangle and posterior triangles. In the anterior region, lateral region, posterior region of the neck. The posterior triangle. This is the posterior triangle. The posterior triangle, which is limited anteriorly by the posterior border of the sternocleidomastoid muscles, posteriorly by the anterior border of the trapezius muscles, inferiorly by the mid-third of the clavicle. Okay, and it can be divided into into two triangles, which is called occipital triangle and supraclavicular triangle. By what? By inferior belly of the omohyoid muscles. Omohyoid, which has two bellies, anterior bellies and superior bellies, or sometimes called anterior bellies. Okay, and inferior belly of the omohyoid muscle. So it divided into two triangles. Occipital triangles, this occipital triangles, and this is supraclavicular triangle. Also, the roof, as I said, the roof of the posterior triangle form the investing layer of the deep cervical fascia, while the floor is muscles covered by prevertebral layer. Muscles of the floor, which are splenius capitis, levator scalenus, middle scalenus, posterior scalenus, and rarely anterior scalenus muscle. And also the content is not limited to these structures, also to these muscles. Also external jugular vein, cervical plexus, accessory nerve, brachial plexus, trunk, transverse cervical chain, supraclavicular artery, third part of the supraclavicular artery, supraclavicular nerve, cervical lymph nodes, phrenic nerve. All of these structures lies in the posterior triangle. The anterior triangle. The anterior triangle, as we can see here, the anterior triangle boundaries by the anterior border of the sternocleidomastoid muscles, the midline anteriorly, and superior part of the inferior mandible. Okay, inferior mandible, superiorly by the inferior mandible. We divide it into four smaller triangle for purpose of descriptions. So for purpose of descriptions, it can be divided into four smaller triangles. These are four smaller triangles. Just magnify this picture, which are submandibular triangle, submental triangle, carotid triangle, and anterior muscular triangle. The submandibular triangle. This is the submandibular triangle. Submandibular triangle, which lies between the inferior part of the mandible and anterior belly and posterior bellies of the digastric muscles. This is submandibular triangle, and which contains submandibular lymph nodes, submandibular duct, and submandibular gland. Submental triangle. This is submental triangle, which lies between the body of the hyoid bone inferiorly and right and left anterior belly of the digastric muscles, and the apex of the mandibular symphysis, and which contains submental lymph nodes. This contains submental lymph nodes. Also, we have carotid triangle. These are carotid. This is a carotid triangle, which is bounded superiorly by posterior belly of the digastric, superiorly by the posterior belly of the digastric muscles, okay, and by superior belly of the omohyoid muscles, and anterior border of the sternocleidomastoid muscle. Okay, so superiorly by inferior border of the digastric, posterior belly of the digastric muscles, and superior belly of the omohyoid muscles, and anteriorly by anterior border of the sternocleidomastoid muscles, which contain also carotid sheath with its contents, carotid artery, pterygoid artery, vagus nerve, bifurcation of the common carotid artery, and internal and external carotid arteries, also which contain carotid sinus and carotid body. Muscular, also we have, this is muscular triangle, which lies what? Between the anterior border of the sternocleidomastoid muscles, okay, and superior belly of the omohyoid muscles. This is the inferiorly by the sternocleidomastoid muscle and sternocleidomastoid muscle, and superior part by what? By the superior belly of the omohyoid muscle and midline of the neck. Also it contains infrahyoid muscles, thyroid and parathyroid gland. Summary: fascial layers and space prevent spread of infections and surgery. And also understand the fascial spaces and directions of the flow of the blood. Okay, we should understand the fascial spaces and direction flow of the blood. Okay, also plus to the triangles of the neck, boundaries and contents. Okay, these are the most important subjects. Also demonstrate the action of the sternocleidomastoid muscles and explain the torticollis. I need from you to know all of these subjects, facial layers of the and the spaces, okay, and also all of these subjects, which is very important, okay, facial layers, spaces, how to prevent the infection, and also triangles of the neck, boundaries, contents, demonstration the action of the sternocleidomastoid muscles, and explain what do you mean by torticollis. What do you mean by torticollis? And thank you very much, and I am ready for any question. Just email me. Thank you again.